Sabila, and thank you for sharing your personal tragedy and all of the sentiments that flow with that. And finally, Dr. Karma B. Warren, who is an emergency physician here, an adjunct professor as well, and has been at the front lines of seeing this challenge and how it affects real-life people. Dr. Warren?
Good morning. Good morning to Senator Menendez and the other elected officials, to a New Jersey Medical School leader, Dean Johnson, in his absence, to University Hospital CEO and President, Dr. El Nahal, and other medical school and hospital officials in attendance, and especially to my colleagues in medicine and public health. I salute you. I salute all your efforts to protect against future health crises. I am Dr. Karma Brown Warren. I'm an associate professor here at New Jersey Medical School, and I'm also an attending physician in the University Hospital in the emergency room. As an emergency physician at this level 1 trauma center, where we take care of some of the sickest patients in New Jersey, I speak on behalf of all of us who worked daily in the trenches, risking our own health and our safety, especially during the pandemic. So when I was asked to speak about my experiences being on the front lines, well, I jumped at the chance. Why? I needed people to understand, especially the non-believers, the doubters, the anti-vaxxers, those who claimed, well, it really wasn't that bad, or said, well, I didn't get it. They needed to understand this was real, this was scary, and unfortunately, this was us. Let me take you back to last spring on those days in the emergency room when I was talking to you one minute and coding you the next. It was your daughter, your cousin, your grandparent, your son, and they were the ones that we could not save. It was the community of color that made up more than the 40% of the 860,000 infections in New Jersey state alone. What was even scarier is that we as physicians didn't even know the best way to treat the coronavirus, also known as COVID-19. We knew those with COVID morbidities and comorbidities were at greatest risk for severe illness and death, but I couldn't explain that healthy 30-year-old female or male that came in and was just as severely ill. Who was not immune to this? We are in a better place now, so I have to say that. And with the current vaccines, we are continuing the upslope, but we must be vigilant with the fight and prepare for the next one. See, it was during the pandemic that some things went right in some places and terribly wrong in others. The commission that Senator Menendez has introduced will be uniquely positioned to gather all the facts that will examine the challenges and prepare a preparedness strategy that will guide us by the good work and innovations that my colleagues have developed to deal with these unprecedented conditions. Like a strong military does after a war, it has become clear that we have an effective response to this global healthcare emergency. It will require a comprehensive after-action report and briefing so that we, the troops, can learn from one another and support one another and not repeat the same mistakes. In my opinion, there should be no time wasted in strengthening our public health infrastructure by establishing the National Coronavirus Commission Act of 2021. Therefore, I stand in support of and applaud Senator Menendez for this healthcare advantage. And honestly, I don't ever, and I mean ever, want to see another year like 2020 of unpreparedness again. Thank you.